Hi everyone. So for this week, taking into consideration the use of the RNR model for justice-involved persons with mental health issues, I don't know that I like that approach. I liked the RNR model previously when we discussed it as a general way to reduce recidivism among justice-involved persons, but when it comes to mental health issues and utilizing it for the general population and those individuals with mental health issues, I almost feel as though it is the system's way of just utilizing a one-size-fits-all approach to care and services for justice-involved persons rather than taking into consideration like the needs of the populations that are being served. Yes, reducing recidivism is important in both populations, but their needs and risks, which answers the second question, I believe are different. Their risk factors as far as like whether or not the individual is on their medication and maintains that while they are released from jail, is going to be something that needs to be taken into consideration that's different rather than maybe teaching an individual like to think cognitively and maybe morally and ethically about their decisions. I think the one slide in the PowerPoint that really stood out to me is when it comes to those individuals with mental health concerns like schizophrenia or those suffering from audio or visual hallucinations. A lot of the times those precede a criminal act. And so that is going to warrant a different response about how that individual is treated, whether it's with medication and therapy, and then also how that can be maintained for if and when they're released from jail. So I don't think that while I do like this model for the general population, I don't know that it's appropriate. I don't believe that it's appropriate for the use of justice-involved persons who are dealing with mental health issues because their needs are different and the way that they should be approached is also different. I almost feel like, I think I've already said this, but I feel as though this is just another way that the system is trying to make things easier for the system and not for the people that are involved in the system. It's more of a one-stop shop and like you all get the same treatment without really knowing if there is an overall like positive outcome to the greater society with this approach. So those are my thoughts. I'm looking forward to seeing some other people's opinions on this.